nerve today. Probably more with the professionals. I did a Mythbuster Monday today on, I've seen this going around a lot, that, your jaw issue is directly connected to your pelvic floor. And I will go so far as to say, I typically will screen for lots of things when I'm talking to a patient. Do you have headaches? Do you have jaw issues? Do you have neck pain? Do you have back pain? Do you have hip pain? I want to find out what other comorbidities, because there tends to be patterns. Now, where we get into trouble, I think, as providers is the explanation of those patterns. There's a lot of explanations I've seen, everything from embryology to fascial connections to pressure, like all that kind of stuff. And I think it's important as providers that we understand our biases. Like, I have providers that I work with in this area that I know are really great myofascial and craniosacral and visceral providers. I have gone so far as to take initial coursework. It didn't resonate with me. It wasn't my jam. I didn't pursue it. But if I have somebody that I feel like would be a good fit for that approach, 100% I'm going to refer them. And I think I will give myself a little bit of credit here. Like, I tend to be somebody, before I am going to just negate an approach or something like that, I'm going to go try and experience it and try and understand it. I'm not going to try and be a perfectionist in it. I'm going to see if it resonates with how I think. That's kind of how I ended up, quite honestly, doing CrossFit. Was I went to a female athlete course because I was starting to see more powerlifters. And I got there and I'm like, oh crap, this is resonating with me. I'd had hip surgery. I was a runner. Things had not gotten better. And I realized that I needed to do some load training, and it resonated with me enough that I literally, within a couple months, went to a CrossFit gym, put my head down, didn't tell anybody for a year that I was a PT, finally came out that I was. And then that's a major part of who I work with now. So I think it's incredibly important that as we give our patients explanations as to why we think something is going on, we need to be conscientious of where our understanding and our bias is. And I made a comment to someone earlier about how I don't like Kool-Aid. Like, I'm not all one thing or another. Like, I'm a huge fan of the mashup, because I think it's naive to think that we understand everything. I think where we are clinically, yes, is in a very different place than we are research-wise. We can't even have a conversation about RCTs. It's just not a thing. Don't get me started on Cochrane reviews, because that's a whole nother shit show, quite honestly. But I think if you are a patient, I think it's incredibly important to understand that your providers may have biases. Let's take manual therapy versus exercise, for example. A lot of pelvic floor physical therapists were trained to do internal assessment, internal work. Not as many pelvic floor therapists are trained in orthopedic assessment of the hips or back or manual treatment or things along those lines. My background personally, have manual therapy certification through where I got my DPT. I used to treat far more internally, far more manually. I used to do dry needling. I used to do far more interventions that I was required to be a part of. Like, somebody was looking for me to do something to them. My ideology has shifted a lot, such that I want clients to feel agency. I want them to feel that they have the ability to problem solve and figure stuff out and manage things, and then only come to me when there's, more challenging things going on. So if you're a client that I, work with 10, 15, 20 years ago, I would treat you very differently now than I did then. And that's a point of pride for me, that my practice has evolved. But again, I think it's important to understand, are you going to somebody that is primarily manually focused? Are you going to somebody who is like posture restoration or visceral, or, whatever the approach du jour is? And that's where they call the art of physical therapy. And again, I'm not saying that any of these things are good or bad or otherwise. There's a place for them. But my practice, because the bulk of people that I see and work with are coming to me after seeing multiple other providers and they're not where they want to be, it allows me the unique opportunity to be able to sit back and say, okay, you did this, 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 and this. It didn't work. My job is to look for the holes in the gaps. So that's how my brain works, is like, all right, where are you missing something? Where have you kind of like checked the boxes, and where are the gaps? And my job is to figure out, okay, where am I going to get the most bang for our buck? Where can we get the most amount of results for the least amount of effort? I refer to that as Mom 101. How little do you need to do so no one dies? Because I work with a lot of moms and we ain't got time for anything. So back to this post today, because some people were a little pissed about it, and that's fine. And I would ask you to examine why that triggered you. Did I challenge your bias that you may or may not know that you have? And if I triggered you, is that something that you're interested in exploring with yourself further? Like, I don't need to be a part of that, but is that something that's important? Like, do you realize that you look at clients in a certain way and you might be missing something? And again, if you're working with a provider and you're not getting better, that doesn't mean that we all treat that way. It may be that this person may not be the right person that matches up with your problem. So I get questions all the time. Well, what about this approach? What about that approach? Like, I have no idea. Like, I really don't. And chances are they don't know either. But the thing at the end of the day is we need to lay everything out, get a good idea of what we think is going on. So go in with a hypothesis and then pick whatever intervention or whatever is appropriate to match where that gap is or match what that problem is. If you're just going in and saying, all right, well, I'm just going to hit it with a hammer no matter what, because that's what I think is going on with everybody is a hammer and everybody's a nail. Like, and that's my thought of, and that's kind of where I refer to the Kool-Aid. Like, I think we're far too complex to assume that there's one answer for everything, and far too complex to think that there's one approach to everything. I think theories are convenient. I've gone through my own phases of theories over the years. Again, that's why I treat differently now than I did, 18 months ago. I don't do nearly as much manual work now as I did even 5 years ago, because the pandemic showed me that I didn't need to. I could get results in less time. And I think where that becomes relevant is your patient population. If you're with a population that, feels like they need you to get better, great. If you have a population like ultra runners that are like, hey, so I start to have leakage around blah, 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 and I can't reproduce that in clinic, I sure as hell better have a better explanation and some things that they can try on their next challenge that I can't, their next run that I can't do in the office. So again, that's where some of that comes from. But I was fully aware that I was going to, probably ruffle some feathers today in that. But I'm really curious, those of you out there who've read it, and definitely read the comments, because it's getting spicy in there right now. I'm trying to put a little levity to it, but sometimes how that goes. Did I, get under your skin a little bit, or are you like, oh no, yeah, no, I totally get you. Or if you are a patient and you're reading this and like, oh, well, my provider told me this, but you're saying this, what the heck is going on? Like, I really would love to kind of hear from you what you kind of like, what's your visceral reaction? What's your gut reaction? Because chances are, if it bothered you, if it made you feel defensive, then there's probably something there to unpack. And again, you don't need to unpack it with me. I don't have enough room on my plate to crack that egg. But I would just encourage you to explore, even if you're like, oh yeah, no, that's totally my jam. Like, why are you like, oh yeah, why do you think that way? Why do we think the way we do? Why do we go to the providers that we see? Why do we resonate with them, or the provider that's you're not resonating with? When do you say, it's not me, I just need to find somebody else that matches up? I think that's a fantastic question that we all need to self-reflect on ourselves as providers and consumers. But hop in my DMs. I know no one really wants to hop up and tell me how they're feeling here on the live, but hop in my DMs. I would love to hear from you and what that reflection is. Oop, I can't get myself off here. Off screen. Nope, still doesn't want to do it. There we go.